During natural intercourse, only a fraction of the sperm make it up to the woman's genital tract. Intra-uterine insemination, or IUI, is a fertility-enhancing procedure in which washed or concentrated sperm are placed directly into the uterus at the time of ovulation. Intra-uterine insemination increases the number of sperm in the uterus and fallopian tubes, where fertilization takes place. IUI is a relatively simple procedure that involves passing a fine, soft, flexible catheter through the woman's vagina and cervix into her uterus. This process might require fertility drugs or may be done without medication. IUI can be done with your partner's sperm or with commercially purchased donor sperm. There are generally 4 phases to an IUI cycle: a stimulation or monitoring phase, ovulation, insemination, and a luteal phase. We'll go into each of these in detail. Stimulation of ovulation for IUI usually starts on day 2 to 5 of your menstrual cycle. Fertility pills are taken orally and are prescribed for 5 consecutive days. Most women do not report side effects from taking fertility pills, but those who do may have headaches, hot flashes, breast tenderness, visual disturbances, abdominal discomfort, and/or nausea. The main risk of fertility pills is multiple pregnancy. If fertility pills are not effective, injections of gonadotropins may be necessary. Gonadotropins are given by injection in order to stimulate the growth of more than one follicle or potential egg. These injections will be daily for approximately 7 to 12 days. Temporary side effects may include inflammation at the injection site, mood swings, breast tenderness, abdominal bloating or discomfort, fatigue or restlessness, and headache. Blood tests, which monitor your estradiol and luteinizing hormone, or LH, and ultrasounds are done to monitor your response to the medication. This will determine when the follicles are mature and ready to ovulate. Ultrasounds are also done to minimize the risk of overstimulation of the ovaries and multiple births. Blood work will determine when you are ready to ovulate. If you don't ovulate naturally, a hormone called HCG will be given. Ovulation usually occurs 36 to 48 hours after this final injection. On the morning of your insemination, a semen sample is prepared by our laboratory. Millions of concentrated sperm are then passed through your cervix into the uterus using a catheter. The procedure takes only a few minutes and is relatively painless. The luteal phase is the 2-week waiting period between the insemination and the pregnancy test. Millions of sperm must travel from the uterus through the fallopian tubes to meet the egg. Many sperm will surround the egg, but only one will penetrate its outer shell. Cell division will occur as the fertilized egg travels down the fallopian tube back to the uterus. Approximately 1 week after fertilization, it will embed itself into the thickened wall of the uterus, a process called implantation. The lining of the uterus is uniquely designed to enhance the process of embryo implantation. Special secretions of nutrients assist the embryo in the process of continuing development, attaching to the uterine wall, and developing the placental cells. The embryo is now safely housed within the walls of the uterus. There is very little you can do at this point to affect the chances of successful implantation. Whether or not the embryo or embryos implant in the uterus is primarily dependent on the health of the embryo. And many of the tests at this point can send us mixed signals. A blood test to determine pregnancy will be done approximately 2 weeks after your procedure. Bleeding can occur before your test. While this is very disappointing, it does not always mean the treatment was unsuccessful. Some women experience unexplained bleeding during pregnancy, so you should continue using the progesterone until the results of the blood test are confirmed. Now, at the same time, the progesterone may delay your period. This does not necessarily mean you are pregnant, so there can be a fair bit of uncertain waiting at this point. Your best bet is to keep your eye on the ultimate goal and not to get caught up in uncertainties of these tests. Eventually, if the pregnancy test is conclusively positive, you will continue to take progesterone supplements. If it is negative, you will stop the progesterone. It is recommended that you take a break before resuming treatment. If the pregnancy test is positive, an ultrasound will be arranged for about 3 weeks later. This will confirm the location of the pregnancy in the uterus and determine whether it is a single or multiple pregnancy. And a heartbeat should be seen at this point. Multiple pregnancy, for instance, twins, triplets, or quadruplets, is a potential risk of any fertility treatment. Multiple pregnancies carry a higher risk of premature delivery and miscarriage. Therefore, every attempt is made to avoid them. If your doctor discovers that you've produced many follicles, it may be necessary to cancel your cycle. Your doctor will discuss the situation with you if it arises, and other options will be explored. Other risks include ectopic pregnancy, where the fertilized egg implants outside the uterus, usually in the fallopian tube, and needs immediate medical attention, as it cannot develop normally there. In less than 2% of cases, ovarian hyperstimulation syndrome develops. In OHSS, the ovaries become enlarged, and extra fluid can accumulate in the abdomen, and there is a slight risk of developing blood clots. This complication requires rest, close monitoring, and may require hospitalization for intravenous fluids or the drainage of the abdominal cavity. As with all fertility treatments, the first time might not work. If your ovaries are not responding to the medication, your doctor will likely suggest stopping that cycle and trying a new protocol. This trial and error is a regular part of the assisted fertility process. It's important to expect it and keep a positive attitude in your work towards a successful pregnancy.